أول حاجة رحب بكم مرة ثانية. حقيقة we are entering a totally new era in healthcare practice. Over the next few years, I think within the next 2 to 3 years only, healthcare practice would change drastically as AI takes over actually lots of activities that we used to do ourselves as human beings. Now AI as machines or digital beings as they're called, these are the ones who are going to take over lots of the work that we're doing in medicine. Now, what I thought I'll do today is just give people a feel of how AI dramatically changes the way we care for our patients. You know, it's not similar to anything we have been doing before. This is something totally new. That's why it's called a new era. I'm going to briefly just talk about AI. I must say that I'm not an AI expert, but I'm gradually becoming an expert in using AI rather than an AI expert. It's the science itself. But now we are in an era where we have to really master the use of AI. I'm going to focus today on acute clinical care, but AI has so many more uses than just clinical care, right? A simple definition of artificial intelligence is the simulation of human intelligence by software coded heuristics. Now, AI are actually machines, right, or computer machines, but they can behave just like humans. They have cognitive abilities. They can see, they can hear, right? They can read our face and recognize our faces. They can even recognize our emotions. They can hear, we can speak to them. They can interpret what we're telling them and learn from the data we give them, right? And they can even solve problems and take actions. So they actually, in essence, behave just like human beings in all aspects. That's why they're called digital beings. Now, these digital beings are going to take over the world by storm over the next few years. We're going to see these digital beings everywhere around us, as we go through the, in the marketplace, in the airport, in the hospital, all over the place, there will be digital beings around us, okay? Some, important, concepts that people, dealing with AI should be aware of. One is called machine learning. Now, this is the basic stuff. Machines are taught all this data, and when you ask them a question, they actually utilize pattern recognition in finding out what you are, in finding out the answer for your questions. Now, these questions are called prompts. So when you put a prompt, this AI interface would actually try to figure out a similar pattern, a similar thing to what you have written. And it gives you back all the information of relevance to that pattern they have recognized. AI can sometimes be interconnected through something called neural networks, just like what neurons in the head, in the brain do. And so, so many computers are interconnected, right? And so through these neural networks. AI can do something called natural language processing. And this is the beauty of AI. One of the beauties of AI is that they can actually appreciate what you're telling them and interpret it, right? Even whichever language you're using, right? If you're speaking to them in a Sudanese dialect, they will still appreciate what you're saying. They might even answer you in the Sudanese dialect, right? And even further, going further, AI, robots can actually take actions, right? So do, manual stuff, just like what human beings do. So you can actually have a feel of how these, AI platforms or robots, have so much, capabilities, once you feed them all with all the information, right? We have AI around us all over the place. When we search Google, actually, Google uses AI, right, to answer your queries and give you suggestions, right? And the same thing for YouTube, they all use, or Netflix, they all use AI. Self-driving vehicles, automatic language translation. Now you can speak in one language, right? And then the interpretation comes in a different language, right? AI can do facial recognition, and that's what we do when we use our phones. Our phones can recognize our face and unlock the phone. Computer games, spam filters. So AI is around us all over the place. But the critical element is that you can yourself use AI in so many other things in everyday practice, in everyday life. Okay. Now, in medicine, it's still in its infancy, but you can see how powerful it's becoming, right? Now, AI can help us in diagnostics. Radiologists in the future, we don't really need radiologists to read our X-rays or CTs. These are done through AI, and a patient who has an X-ray will get the report just in another minute, right? A full report that's even better than what radiologists can do. This has actually been proven by research. And even for histology, for example, or retinal images or so forth, image analysis is becoming the #1 use of AI in medicine. It can even detect early diseases, cancer, cardiovascular conditions, with just feeding them with patients' data before actually even our normal tests can identify or detect, right? It can predict disease risk assessment. It can provide personalized medicine. It's great in drug discovery. You feed them with all sorts of chemicals, and they, from their algorithmic data, they can actually tell you this drug is probably going to work on this specific condition. So we're going to see new drugs, coming very fast into the market, right, through AI, right? Robotic surgery, virtual health assistants. People could actually, we've used it actually, in our everyday practice. It's actually the AI is a virtual health assistant. You can also have it like a chatbot. You can speak to a chatbot, which interprets what you're saying, your symptoms, right? And even if you put your temperature and pulse rate and so forth and blood pressure, it can interpret all these, right? So it can actually work as a virtual health assistant. It can also work for patient monitoring remotely using AI, digital machines for patient monitoring. Natural language processing. Now, as you're taking the history, right, the AI can actually take all the data, organize it and give you the diagnosis and the necessary tests, even before actually sitting on your computer. It can automatically do all this, analyzing all the data you've actually gathered from the patients and suggest the diagnosis and suggest the treatment. So you don't have to actually sit and type. And it has so many administrative applications in healthcare, and this can automate so many actions in healthcare. Obviously, clinical decision support systems, which you can incorporate in electronic medical records, and it can reduce diagnostic errors dramatically and can provide evidence-based recommendations. Telemedicine enhancement, mental health support, epidemiology and public health research. It can even predict outbreaks long time before they come. They start appearing, right? It can analyze social determinants of health, impacting community wellness and so forth. The uses of AI in medicine are enormous. Every one of these topics actually would actually, be enough to run a full day course on AI. But one has to actually pause and just give you this important slide. AI is supposed to complement and augment our abilities, not to replace them. This is a very important statement. AI is for complementing and augmenting our capabilities. And I can tell you, it can do it, and you actually start having superhuman skills. This is literally what happens when you start using AI. You develop superhuman skills when you use AI. It will actually highlight things you have never thought about when you are seeing a patient, or even trying to figure out what's wrong with the data or so forth, for everything in health practice. And I'm going to go through actually a practical case, right? And I'll show you how I used AI to actually augment my abilities in actually tackling this patient. It lacks something very essential, that human element in patient care, the empathy, the compassionate care, right? That interpersonal element that's not there in AI, right? There is a lack of transparency. Obviously, you don't know how they've done it, right? It's limited by the training data. So if you put it's the training, they've been trained in certain amount of data. Now, if the data is out of date, you will not get the up-to-date information. So that's why AI, it should complement, it should not replace, because there are other bits which might not be there, depending on how much this AI, machine has been trained. And there are other things, there are ethical concerns. Sometimes there is complexity of patient conditions, and you really need to tie things together. But I can tell you, this case I'm going to discuss with you, right? It's very complex. But the very odd thing is that the AI could actually interconnect and link all the elements based on the information I provided and give me results with these complexities, taken care of. So it can actually look at complex cases as well and give you advice contextually based on the data you've given, right? So the bottom line, AI can really augment and make you, highly skilled, a superhuman. That's what AI does. It does complement, your abilities, augments your skills, and so you can actually provide something super when you're dealing with your patients, okay? One of the issues with AI is something called hallucinations, which means that AI sometimes give you information which has no basis at all, right? People who have developed AI are not sure why AI machines actually, have these hallucinations. But it is a problem, really. It is a problem. But the good thing is they are not many. And as long as you take care of what what you learn from AI, right? And don't just use it blindly. Right. Now, let's move actually how artificial intelligence can help us in decision making in medicine, right? And I'm going to share with you a medical clinical scenario, right? I got the scenario and I used an AI PowerPoint presenter, interface to actually put it there, right? It's called AI PPT. This is actually one of the cheapest AI PowerPoint, preparation AI models or machines, and it actually provided me with all the AI slides that I wanted, and I just had to edit it. It just took me a few minutes to prepare more than 100 slides. Now I'll share with you this story, right? This is a clinical case, and I used this case many years ago in training in evidence-based medicine when we were training people in evidence-based practice and decision making, right? So I used this case a long time ago, but I used it now to provide it to AI, and I wanted to ask AI how to manage this case. And surprise, surprise, AI brought me stuff, or figured some stuff which I didn't even pay attention to before, right? So it just tells you how smarter is AI than us human beings when it looks at patients. Now let's read. I'll read with you the story, right? A 65-year-old woman, she presented to the emergency department complaining of fatigability, epigastric abdominal pain, and nausea. The history is obtained from her daughter as she felt very weak. She had a history of peptic ulcer for several years, for which she has been treated with an H2 blocker. She is a smoker and with an average of 20 to 40 cigarettes per day. She also had a history of left knee osteoarthritis of 3 years duration and regular diclofenac tablets for pain relief. She denied diarrhea, vomiting. She admitted to occasionally passing painless black sticky stool in the last 2 weeks. Now, on examination, the pulse was 130 beats per minute, blood pressure was 92/61. The abdominal examination was remarkable for moderate epigastric tenderness and guarding, with no rebound tenderness. And rectal examination produced dark stool that was GAIAC positive, which is GAIAC positive is a test for fecal blood. Okay. Now, I gave this story to AI. I used ChatGPT. I'm sure many of you know what ChatGPT is. Now, GPT stands for Generative Pre-trained Transformer, right? And I used this new version. It's called ChatGPT 4.0 Mini, right? Which was a one which was more superior than the previous ones. And this is what I'm saying. It's AI is in its infancy. We're going to have more and more powerful AI machines as they've been trained in more data and stuff. And it's going to really blow up our minds, this AI stuff. It's unbelievable. A chatbot means that it's a software which can interpret what you write or talk, verbal or written words. You can talk to them, and these chatbots, you can talk to them, or you can write for them, and you ask them whatever you want. So chatbot, all AI machines are chatbots. Actually, you chat with them. Okay, so ChatGPT is simply a chatbot. Now, I wanted to answer this question, but I wanted to make it tough for ChatGPT. I didn't want to make it a simple, like, what's the diagnosis, what's the differential diagnosis? No, I wanted actually to make it look like a complicated case, like expertly managing this case. So I thought the best way to do it is I'll use something called the competencies, the roles that the CANMEDS talks about. The CANMEDS is a competency-based medical education framework. It simply states that for a clinician to be super clinician, they have to actually practice, 7 roles. They have to practice the role of a medical expert, of a communicator, how to communicate, a collaborator, how to actually interact with the team. As a leader, leader means about quality improvement, about career improvement, about quality, about career management. A health advocate, somebody would advocate for the health, like consultations or preventative or screening tests. A scholar means that you know what is evidence-based medicine and research and so forth. And professional means ethical practice. So the CANMEDS, as a competency-based medical education framework, says that when you're dealing with a patient, you really have to practice all these 7 roles. Otherwise, you have not practiced it as actually an expert clinician. And I also wanted to see whether ChatGPT would actually allow me to go through the 7 golden steps in patient care. Now, these are the 7 golden steps. You gather information from the history, you summarize the case, and you articulated your diagnosis. You articulate a diagnosis and a differential diagnosis, and then you order your tests. You order your tests that you need, and then what are the immediate therapeutic interventions, and you prepare for discharge. So these are the 7 golden steps that all of us as clinicians, go through them when we're actually dealing with the patient, from the history to the discharge, right? So I actually thought I'll use the CANMEDS and these 7 steps and ask ChatGPT, how would I manage such a case, right? Now, what I did was actually, I'm sorry, there's some part missing, right? But I actually asked GPT 22 questions, right? What's the patient presentation, diagnosis? What is the severity score? What are the necessary investigations, empathetic communication, discharge planning? What's the length of stay and discharge criteria? What would the vancomycin dose be in such a patient if her kidneys are not good? What is the sensitivity and specificity of stool Helicobacter pylori test? What is the evidence-based management of bleeding peptic ulcer disease? How would I resuscitate? Shall I use saline or albumin? System-wide and community interventions to reduce upper GI bleeding. See, I wanted to go deeper into how to ask ChatGPT. Can you tell me some research ideas in GI bleeding? Can you tell me of some audit ideas for gastrointestinal bleeding? If I wanted to train a junior doctor about competencies on GI bleeding, what are your suggestions? You know, if I wanted to improve the whole hospital and system interventions for GI bleeding in the hospital, clinical pathways for managing upper GI bleeding, what are the recommendations for DVT prophylaxis in upper GI bleeding? What would be the management of a massive pulmonary embolism in such a patient, right? You see, I asked this question, and ChatGPT has to answer based on the contextual, you know, that this patient is having bleed, right? How would I manage severe anemia in a patient who is a Jehovah's Witness? And Jehovah's Witness means that these are people who actually would never accept blood transfusion, and we come across them in the West when we've been training in the UK. If there is an error in the care of a junior doctor, you know, looking after this patient, how should I actually approach that? And then I even went further and I said, this is a research paper I got on GI bleeding. Can you help me do a critical appraisal for this for an article so that I can use it in a journal club? Right, and these are the questions I've asked. Right, 22 questions in all. Right, and for me this was a test for ChatGPT. I would compare them to obviously my knowledge, plus also the guidelines. Actually, I looked at the guidelines as well to make sure that ChatGPT is not hallucinating. The bottom line was that the answers were really super fast. You know, hardly waited for anything for any answer to come through. It is great in providing contextual recommendations because it's talking about a patient with these findings, you know, so it actually recognized the context. It doesn't look at only upper GI bleed. No, it looks at upper GI bleed, smoking history, the blood pressure, you know, it's able to interpret things contextually, all of them together. It's very comprehensive. You know, it always gives something extra that I have not thought about. It gave me extra suggestions that I have not thought about at all. Mostly, it's more than 90% accurate. It gives accurate information, right? If you know about the relevant background information, right, that helps you judge the truthfulness. Because as I said, AI, you know, you still have to be extra careful. It's not supposed to replace your own judgment. It should augment your judgment, you know, make you do things better, right? And obviously you can ask anything for ChatGPT. Now the patient presentation, it's actually summarized everything, right? If you don't mind, if I go there. No, I need to just go out and correct something, sorry, in the presentation. Right, okay. Right, I'll go back, sorry, because I think Right. Okay. Yeah. I hope you can see with me now. Okay. Muhammad just confirmed.
واضحه يا بروف.
Okay. So when I asked about the symptoms, I wanted the ChatGPT, right, to summarize everything properly, right? And for us, summarizing a long history is actually the first step to get to the right diagnosis and management. Okay. And it was wonderful. You see, you can see that it actually picked up. It picked up the important things: 65-year-old woman, fatigability, gastric pain, nausea, peptic ulcer, H2 blocker, history of smoking, left knee osteoarthritis. It picked up the right vital signs, physical examination, rectal examination, right? It picked up the relevant information. So it's actually great in summarizing the important parts. But even more wonderful was actually its ability to write. Instead of writing only painless black sticky stools, it actually interprets as melena. Now, this is actually, I copied it from ChatGPT. It interpreted it correctly. It said this is melena, right? So it read and interpreted, right? Again, in the history, I wrote that the heart rate was 100 plus, right? But then when it summarized it in the problem representation and illness script, it's called tachycardic. Right, it was 130. And the low blood pressure, it's called hypotension, moderate gastric tenderness and gouging, right? And then he came up with a diagnosis. So the beauty was that the ChatGPT actually managed to summarize and come up with a diagnosis, and obviously for me, that was good. For somebody who's junior, who's seeing a patient who's not sure what's wrong with them, they can easily try ChatGPT to see whether they can help them make up the diagnosis, come up with a diagnosis, right? It just came, I asked, what's the diagnosis? It's written upper GI bleed, right? And it started telling me why. These are the symptoms, these are the history, these are the vital signs, these are the physical examination, right? I asked him, can you please tell me, how do you assess the severity score and prognosis for this patient, right? And it straight away got me the Glasgow Plattsford score for GI bleed, and obviously started writing all the data, right? And also gave me the ROCAL score and gave me an idea about the prognosis and risk stratification, right? These are all part of the medical expert role in the CanMed, right? I asked, what are the necessary investigations? It straight away gave me the complete blood count, urea nitrogen, coagulation profile, liver function test, type and cross match, right? But I was actually surprised that, it gave me Helicobacter pylori testing, it gave me electrolyte panel, but also gave me pregnancy test, which I liked. So obviously, one patient was actually a menopausal 60 plus patient, but at least it reminded me that, okay, maybe there's some patients that I need to do pregnancy test on if they, childbearing age, right? I asked, what are the imaging, the tests that the chat GPT gave me: abdominal X-ray, abdominal ultrasound, or CT and angiography. Things that have not come to my mind straight away. As a matter of fact, I did not think about them straight away, right? And it's also, I asked, what would be the timing of the esophagogastroduodenoscopy for this woman, and it said it has to be done within 24 hours. You see, and actually this is what the guidelines are saying for people with severe gastrointestinal hemorrhage, right? It explained exactly why, endoscopy, abdominal X-ray, abdominal ultrasound, or CT angiography are useful, right? And as I said, for me, CT angiography did not cross my mind, but it brought it to me so that if endoscopy fails to identify the bleeding source, or if there is concern for vascular malformation, mesenteric or ischemia or large vessel, CT angiography can help localize the bleeding focus, especially massive bleed. So it actually reminded me of something I'm aware of, but I didn't think about it at the time for this lady. And at the same time, it also, even the abdominal CT, it was highlighting few issues that I was not thinking about, like a gastric perforation or gastrocolic fistula or so forth. Right. So Not only it actually provided me with the tests, but also the rationale for everything, and actually broadened my investigation panel so that I'm aware of what I can do. I asked about what are the initial resuscitation and stabilization, and it gave me all the details: access, IV fluid, IV access, fluid resuscitation, blood transfusion, oxygen supplementation. I said, how do you monitor this patient? Okay, continuous monitoring, vitals, urine output, hemoglobin levels, right? I went to, this was the medical expert part. So I said, okay, I go to the communicator competency now. Right? I wanted to communicate in an empathetic way with this lady, right? So I asked ChatGPT, can you please tell me how to communicate empathetically with this lady? So actually, it gave me all the tips I need actually to empathetically deal with this patient, introducing yourself, build rapport, acknowledge patient discomfort, and so forth. Right? Check for understanding, ensure physical and emotional comfort, support the patient, provide clear steps, involve patient in care planning. Beautiful, actually, guide, right? The interesting thing, right? It actually, asking, I want to ask ChatGPT, okay, tell me how to say it, really, right? So it actually gave it all to me. It's written actually how you should actually write or tell the patient. I can see that you are feeling very weak and uncomfortable right now. I want you to know that we are here to help you and feel better as quickly as possible. I asked, can you please give me these empathetic phrases in Arabic? And surprise, surprise, it gave me all in Arabic with the right words that I have to use. Okay, so it told me, أنا هنا, my name, مرحبا, أنا هنا لا داعي للقلق, نحن هنا لا نعرف سبب ما يحدث, سنتعامل معه بسرعة. Even when I asked empathetic phrases in Arabic, it was able to tell me. Okay, the interesting thing, right? I didn't say I was a Muslim or whatever. I didn't say my religion, but it actually wrote this to me. In some Arabic-speaking cultures, it is common to use phrases like "Inshallah" when expressing hope or reassurance. For instance, you might say "Inshallah تستشعرين بتحسن قريب." You see, when I asked in Arabic, it actually gave me this culturally useful hint. Okay, I asked about discharge planning, right? And so the ChatGPT started explaining about diagnosis of GI bleeding, clarification of treatment provided, and what are the elements you should focus on for discharge planning, like medication, understanding medications, proton pump inhibitors and supplements, and pain management. Dietary, it even told me about dietary recommendations that I should tell this patient about in my discharge planning, right? Avoiding spicy foods and focusing on plant diet, right? I asked about follow-up. How shall I arrange for follow-up? And it gave me, gastroenterology follow-up or primary care follow-up or hematology follow-up. It's actually even suggesting other specialties that might need to be following up this lady. Okay. In my discharge planning, it gave me also the red flags and the warning signs that I should be telling the patient about. These automatically came through in its output, right? The red flags and warning signs, support systems and mental health, how to provide psychosocial and emotional support. It also provided inputs about home care and safety. If you have home care services, you can discuss with and ensure post-discharge care, right? I asked about patient education. It automatically also gave me patient education and written instructions, right? Addressing support needs and so forth. So it actually gave me a full comprehensive discharge planning output, okay? I asked what's the length of stay and discharge criteria, and it told me that if it's a mild to moderate GI bleed, it will take 3 to 4 days. If it's a severe bleed, it will take 5 to 7 days. So these are based on international data, right? What are the criteria for discharge? It gave me all the criteria for discharge. And we tell we tell our trainees, by all means, try to decide on the criteria for discharge and admission so that you can discharge patients earlier, otherwise you keep them forever, right? So I asked about what are the criteria for discharge, and it gave me all these 7 criteria for discharge, including obviously hemodynamic stability and obviously patient and family education, follow-up arrangements, and no new complications, and so on. Right? A very interesting thing, I said, I want to give this patient vancomycin, and this is her creatinine clearance. Can you please tell me? Right? I told the creatinine clearance for this lady is 40 mils a minute. Right? I want you to tell me what would be the vancomycin dose for this lady. Right? And it straight away gave me the loading dose and the maintenance dose. And this is something, sometimes we do it ourselves, sometimes we ask our clinical pharmacists, but the fast, how AI gave us in less than 10 seconds. Instead of having to go and calculate and ask the clinical pharmacist, it just straight away gave us the dose, okay? And, and how to monitor the vancomycin levels and so forth. I asked about sensitivity and specificity of stool Helicobacter pylori test, and it straight away gave me the diagnostic accuracy of stool antigen test, serology, and biopsy, right? The sensitivity and specificity of each. I didn't check whether these are correct or not, but I assume they are correct. But by all means, again, it answered me these questions, in no time, super fast, okay? And it explained every one of them, the stool antigen test, the serology and the biopsy, sensitivity and specificity of each, and the biopsy is the gold standard, and so forth. I asked, how can you please give me the evidence-based management of bleeding peptic ulcer disease, right? And he gave me all the headings: hemodynamic stabilization, endoscopic findings and treatment, right? And even gave me something called forest classification for the endoscopic findings. I'm sure this will be very amusing for people, sitting for the exams, right? And he talked about pharmacological therapy, high dose intravenous PPIs or oral PPIs post-acute phase, right? I asked about additional measures. Actually, it wrote it as part of the management. So it actually gave me surgical and geographic interventions, continuous monitoring for post-endoscopic care and management, preventing recurrence, eradication and lifestyle changes, Helicobacter pylori, eradication and avoiding non-steroidal dose, right? I asked this question, shall I resuscitate with saline or albumin in upper GI bleed, right? And it gave me that, okay, if, you can use saline resuscitation, but better albumin, using albumin in cirrhotic patients with ascites, okay, which was, obviously this is good information for somebody who's, a junior doctor, right? And saline is prepared for most upper GI bleed and albumin for cirrhotic patients with variceal bleeding. I wanted to challenge DBT with something more, actually, more than just do this and do this. Something which needs a big holistic view in the community and in the hospital. So I said, what would be the system-wide and community interventions to reduce upper GI bleed? Now, this is an important public health issue. We don't want people to come to hospital with upper GI bleed. So what are the system-wide and community interventions, right? And system-wide interventions, it brought management of risk factors like non-steroidal use and antiplatelets in the community, public health campaigns, education on medication safety, improving access to care, timely access to emergency care. And this is actually the summary. Obviously, it gave it to me. Every one of them, it has detail. What are the system-wide interventions, what are the community interventions, and what are the multidisciplinary collaboration, right? And public health surveillance system. So it gave me a full public health intervention for upper GI bleed, right? I asked, can you provide me with some research ideas in gastrointestinal bleeding? I'm a gastroenterologist, maybe I can do some research ideas. Now, it divided it into pathophysiological research like molecular mechanisms and gut microbiota, like role in inflammatory bowel disease and ulcers, diagnostic innovations like non-invasive diagnostics for biomarkers for early detection, novel pharmacological agents for improving dosing strategies and timing. Now, this is just a summary of these. Basic science, clinical innovations, therapeutic approaches, risk prediction and prognostication, prevention and public health, special populations, health policy. So it actually gave me loads of ideas for research, right? And for any one of them, I can ask actually to write me a full proposal on how to do it. I also asked, can you give me all these ideas for GI bleeds? And he started writing about audit objectives, assessing accuracy and timeliness of early recognition, evaluating time. These are actually, one of the audit items was early recognition and risk stratification. This is the audit objective. And one audit about endoscopy timing and utilization. And this is the audit objective. One about pharmacologic therapy utilization. And these are the audit objectives. And blood product utilization, clinical outcomes and complications. You see, you gave me 8 audits I can work on. The audit ideas I can use for my, if I'm a gastroenterologist or working in a hospital where I can do audit. Right. I asked about, can you suggest some competency-based educational interventions for junior doctors, right? So it's about foundational knowledge of GI bleeding. It wrote about simulation-based training, bedside teaching and direct observation, even talked about juniors attending endoscopy, observation and participation, actually. And these are the ideas that the competency suggestions that the ChatGPT suggested: structured teaching sessions, simulation-based training, bedside teaching, endoscopy, peer learning and multidisciplinary case discussions, auditor reflective practice, online learning modules. And you can see the amount of ideas that ChatGPT can actually pass on to you. You could actually take ages to build all these. ChatGPT gives you the ideas in a fraction of in less than a minute. If you want to build any training program or do audit or anything, ChatGPT or research or whatever, ChatGPT has the power to save you loads of time and give you that extra mile that you need to really be super in your practice. Right? I asked ChatGPT, I want a hospital system interventions for GI bleeding management. Now, this is a question for, the head of the gastrointestinal gastroenterology department, and they want to improve the hospital interventions for GI bleeding management, right? So he started talking about having a standardized protocols and clinical pathways, having rapid response teams and early consultations for GI bleed, having resuscitation and triage processes for GI bleed, having endoscopy services and accesses, and it just gave all what the hospital-wide interventions to improve GI bleeding management. And then when I asked, can you write the clinical pathway for managing upper GI bleed? Right, he gave me the full clinical pathway, objectives and steps, right? The second step, initial assessment and triage, that's the first part of the pathway. Risk stratification, that's the second part of the pathway. Diagnostic evaluation, the third part of the pathway, therapeutic interventions, monitoring and intensive care, discharge and follow-up. So, as a matter of fact, these are the hospital interventions, 10 hospital interventions that can improve the management of gastrointestinal bleeding. You have it all in front of you, ready to just work to implement them in your practice. A full package for improving hospital-wide GI bleeding, right? And then the clinical pathway, it gave me all the 7 elements that I need to have in my clinical pathway, from initial assessment until the monitoring and feedback, quality improvement and audit, right? It gave me everything I needed, right, to build a comprehensive clinical pathway. Now, I asked about recommendations for DVT prophylaxis in GI bleeds, right? And it started by saying you have to start first by assessing the risk of VTE, and it's suggesting the Padua or Caprini risk assessment models, and when to start DVT prophylaxis with early consideration, right? And whether you use intermittent pneumatic compression devices or compression stockings or heparin. And it explained everything about it. Low molecular weight, heparin is as a preferred option, right? And you have to adjust prophylaxis based on comorbidities like cirrhosis or renal failure, timing of resumption if you want to resume anticoagulation. For example, somebody is on an oral anticoagulant, right? So you need to restart and when to restart. Right. I gave this another challenge to ChatGPT. I said this patient developed. I just said this patient developed pulmonary embolism, and actually it actually answered me based on the GI bleed case. Okay, and it told about hemodynamic support, confirmatory tests, CT angiography, anticoagulation and thrombolysis, how to use it carefully, how to monitor. And this was another challenge to ChatGPT. Jehovah's Witness. Now, unless people who are doing the MRCP or, for example, worked in the UK, they wouldn't know what Jehovah's Witness is. But Jehovah's Witness are the people who would not take a blood transfusion. They're a Christian sect. Okay, and now this was it's an ethical dilemma, right? And I wanted to go to that domain of ethical practice. Right. So how would ChatGPT provide an ethical, ethical answer? Right. And it says respecting patient preferences. Obviously, this is all about autonomy, right? And document refusal of transfusion and engagement with the family. Right. Optimize oxygenation and hemodynamics support measures. You can use these to optimize without blood transfusion, fluids and colloids, and alternatives. Now, when it started talking to me about alternatives to blood transfusion, I was really very pleased because it again did not cross my mind initially. One obviously is because we don't see Jehovah's Witness, a lot of people refusing transfusion. But it's important to be aware of this because there might be life savings for such people, right? So it talks about erythropoiesis stimulating agents or iron supplementation, and even talked about blood products which are oxygen carrying blood products that replace blood. Obviously, these are not available everywhere, right? But it mentioned it, which didn't come across my mind. Medical and interventional strategies, endoscopic interventions, and medical surveys, right? And it actually enumerates all these, and it says consult a multidisciplinary team, hematology, ethics, spiritual advisors, right? Use non-blood alternatives like oxygen-carrying agents. You see, it just gave me everything I needed to do to professionally and ethically deal with such a patient who refuses transfusion, right? Another quality and ethical issue was an error in care by a junior doctor. The patient died because the junior doctor did not do the emergency test, right? And so what shall we do? And again, ChatGPT, gave me all the steps. You have to document and acknowledge what happened, right? Internal hospital reporting, multidisciplinary review, and it actually gave me all the steps I should take. Actually, the ethical issues: immediate reporting, internal investigation, root cause analysis, support for the family, reflection and education, strengthening hospital protocols. Right? It gave me everything that I need to do to actually stop this happening again. Okay. Critical appraisal for a journal club presentation, and actually I got I actually copied an article, a research article and I put it in ChatGPT and I said, can you give me a critical appraisal of this? And actually it gave me all the journal club and I could actually put it there and I said, I can actually say, prepare it in a PowerPoint and it will prepare it slide 1, slide 2, slide 3, slide 4. I must say that it's not as good as the ones we do ourselves, right? But at least it's a starter and it can actually, help you, gain some time, save some time. Okay. Like, as I said, I wanted to prepare a PowerPoint presentation. I had I had all the answers from ChatGPT, put them in a Word document. Right? Actually, it came almost more than 70 pages in Word document. More than 70 pages. These 70 pages, these were my answers for this case. Right. I want to prepare it in a PowerPoint. It will take me days to prepare from 70 pages a PowerPoint presentation. So I went to something called AI PPT, right? It's called AI Presentation Maker, AI PPT, right? And I uploaded my document, and I said, okay, just give me a PowerPoint presentation of this. I just had to use a template, and it gave me all these, more than 100 slides. My slides are almost 150. These slides I'm just using, right? And what did I do? Okay, I just edited it and I took some of the stuff out and left some. But actually, it just saved me a lot of time. So there is another one called AI Gamma, also for doing. There are loads of them actually, and people can choose the cheapest to start with. And there are some which are actually for professionals, for educational people, for college and so forth. Okay, right. So in summary, really, AI is going to transform healthcare, whether we like it or not. It's not going to transform healthcare practice only, but it's going to transform our practice, our personal practice. Okay, the whole healthcare system will be transformed by AI. You will see AI everywhere. AI will be the norm in any hospital, right? In the hospital where I'm currently working, they are actually moving to AI altogether. The whole hospital is moving to AI. Okay, so it's going to become the norm, right? The most important individual in the hospital is not going to be the doctor, it's going to be the AI. The healthcare provider, no, it's AI. AI actually will be monitoring and doing things for us all the time, even when we go home, right? Things are going to be all controlled by AI. Whenever I put my prompt, and they call it prompts in AI language, your prompt is your question, your input, right? Whenever I put a prompt, I found that the answers are beyond my expectations. They're always beyond what I've asked. They give you something which you have not thought about. Okay, and that's the beauty of AI. That's why it says augmentation of human skills. You just have to come with the idea, and then AI will transform it in a way that you will be surprised. For people, I know that some of you have already used AI. For people who have not used AI, I am telling them you will be left behind. Your colleagues will go all the way, in their career, and you will not be able to get to them. AI empowers people to actually do things which they're unlikely to be able to do without AI. Okay, AI is actually a powerful tool for improving our cognitive skills in a dramatic way. Okay, when using AI, by all means, you have to be vigilant. Just like when you read any text or article, you cannot just interpret it and use it in your patient. You really have to be vigilant and be careful there, right? Right. AI is a powerful ally, right? It augments our capabilities, right? But we, until now at least, we are super. We have more than the AI because we still have this emotional component, which AI doesn't have, right? And we have this intuitive judgment, right? We judge patients intuitively sometimes, not on data, right? So this actually you cannot do it with AI, right? So AI is here to stay. It's going to transform healthcare. There is no doubt about it. There will be two teams, two healthcare providers, people who know AI and those who don't know AI, and they will unfortunately be left behind. And thank you very much.